a warm good evening to everyone. In the Federation, we have been responding to the COVID-19 outbreak for almost 2 years. The COVID-19 pandemic is unprecedented and extremely complex. It has affected the health system, the education system, the economy, and social life as we know it in the Federation. This period has been unpredictable and unsettling. A few days ago, my mother looked at me and asked, "Hazel, when will COVID end?" I pondered. The scientists are still trying to answer this question, along with predicting what will happen in 2022 and beyond. For us to emerge from this crisis successfully, we must aim to prevent and mitigate the impact of future surges of COVID-19 infections. We have gone through 3 waves of infection or surges so far. The health system worked assiduously. The health team worked assiduously to contain the 3rd wave, which started in early August by implementing the relevant public health and control measures. To date, we have reported 2,774 confirmed cases of COVID-19. 2,716 of these cases have recovered, and we are presently monitoring 30 active cases. There is only 1 individual diagnosed with COVID admitted at the Alexandra Hospital in Nevis, and to date, we've only counted 28 COVID-19 related deaths. Majority of the cases were unvaccinated. The cases who died were mainly older adults, unvaccinated, and had underlying medical conditions. Based on our local data, the unvaccinated in our society are vulnerable and at risk of contracting COVID. Regarding testing, on November 5th, the Ministry of Health sent off a package of 6 samples to Caribbean Public Health Agency for genomic sequencing. 5 samples returned positive for the Lambda variant, and 1 sample returned positive for the Delta variant. The case was identified with the Delta variant, was isolated, and tested negative on November 13th, prior to release from isolation. So in essence, this 1 case was contained and the case was fully recovered before being allowed to integrate in our society. The Lambda variant is the variant in circulation at present. On February the 22nd, the Federation launched a successful COVID-19 vaccination program. In 9 months, we have achieved the following coverage rates. 79.7% of the adults in our population covered with the first dose, and 73.3% of the adults are fully vaccinated. 13.6% of our children have received their first dose, and 11.3% are fully vaccinated. In the Federation, 52.4% of the total population is fully vaccinated. A few months ago, we determined that the critical threshold of 80% coverage rate amongst our adults would automatically trigger further relaxation of our health and travel protocols, as previously outlined by our Honorable Prime Minister. Ladies and gentlemen, we are almost there. The current situation on the ground is favorable. However, this is not the time for complacency. We are not yet out of the woods. The pandemic is ongoing. Let's look at our neighboring islands in the Eastern Caribbean. Barbados, Grenada, Dominica are experiencing outbreaks as we speak. Further afield, we note that cases are surging in Europe. Europe is once again the epicenter of this pandemic. The SARS-CoV-2 virus is circulating and can be reintroduced into our Federation during the Christmas and Carnival season, with the expected influx of travelers. So what steps can we take to prevent and mitigate the impact of a fourth wave. Here are some of the steps that we can take. 1, the COVID-19 vaccine is the best weapon we have to fight this virus so far. We must strengthen and continue our vaccination program that has been so successful. The Ministry of Health and the Ministry of Education will be organizing mass vaccination drives, targeting teenagers in our secondary schools. We want to use this forum to encourage our parents and guardians to be receptive and provide consent for your child to be vaccinated. Vaccinating our teenagers will create a safer school environment and ensure face-to-face engagement and learning. 3, we want to actively target and empower unvaccinated persons who are working in high-risk sectors, like within the hotel and tourism industry, and even in the health sector. We are hoping that these persons recognize their vulnerability, come forward and accept the vaccine. Unvaccinated persons working in these settings can easily pick up the virus, take it home, and into our communities. The second wave started like this, and I'm hoping we are learning from that experience. 4, we want to actively encourage the vulnerable in our population to take the vaccine. And I'm specifically referring to our older adults who have underlying chronic medical conditions like diabetes, hypertension, heart disease, etc. 5, we want to encourage all of society, everyone. We want everyone to come on board and adhere to the COVID-19 prevention and control measures, especially at this time as we approach Christmas. These measures include wearing the face mask, which helps to slow transmission, maintaining adequate hand hygiene, and physical distancing. I want to use this forum to reach out to the patrons of the various carnival events to recognize the value of these measures and adhere to them. The best science does support mask wearing as a valid strategy to reduce the risk of COVID-19. The risk of the fourth wave is real. Let us do all we can to prevent and mitigate its impact on our society. The experts predict that 2022 will be brighter than 2021 for countries like ours that are well vaccinated. Let's press on with our vaccination program. There is light at the end of this pandemic tunnel. Thank you.
Thank you so much, Dr. Laws. We'll now hear from the Chief Executive Officer of Tourism, Raquel.